Health officials say H1N1 is like other types of influenza in that it is spread person to person. They agree that preventive measures like good hand washing and staying away from infected individuals are very effective tools.
One of the things that we try to let students know is that if they're within a 6-foot proximity of someone with that or with flu-like symptoms, whether it's the flu or H1N1, that if that person coughs or sneezes, it can be spread through the air, through droplets, if they're within a 6-foot range. And so we're trying to make students aware of that. That's something that maybe if they notice someone with flu-like symptoms, that they're to try to stay out of that range, which is just one of the many preventative measures I think that's out there.
John Yawn is Director of Resident Services at Marshall University. He says close living quarters on college campuses mean that any communicable disease can spread quickly. Marshall University has implemented several precautionary measures to combat the flu. Personal hand sanitizers have been distributed, educational posters are everywhere, and hand sanitizing stations have been placed in many buildings. There's even been an additional safety in-service.
We actually had training with our custodial staff and our maintenance staff and our department staff about appropriate hand washing and other techniques to really preventative measures from catching anything related to H1N1 or even the seasonal flu that's now approaching.
Yawn says students, faculty, and staff who have questions about H1N1 should access the web for more information.
Probably one of the biggest things I think that's the most important is looking at the website for the information from the CDC to learn about the virus and how they contract it and how they can't contract it, because I think sometimes misinformation can lead to either panic or things being said that are not true, and so we want to make sure there aren't any mistruths out there and that students understand exactly what they can do.
The H1N1 vaccine should be available sometime in the next few weeks. For We Are Marshall Today, I'm Dr. Christopher Swindell.